Welcome to Big Butts No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full-on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the show for you today? I am so excited about my guest today. I have the very exciting and happy Kathleen Lisson. Wait, is it Listen? Listen?
Yep. Listen, like, pay attention.
I love it. And you guys are in for a treat today because Kathleen, how you say in Spanish, she has no hair on her tongue. She's going to give it to us straight. And we're going to talk all about the lymphatic system. Thank you for being on the show.
Thank you so much. I'm so excited.
Me too. Kathleen, I've been following you on social media for years. And something that really attracted me to you and to continue following you is your no crap attitude.
It's the
I love
Generation
it.
X. Yeah, it's a Generation X.
I love it because you're like, hey, if you're going to do this, you better not do this. And honestly, that's what we need. Like, that's
Yeah.
what we need. We need somebody to give it to us straight. So I want you to tell my audience a little bit about you. How did you even get started into this? How did you find your passion?
Yeah, so this is actually the second career for me. I used to live in upstate New York, and my husband moved us out here to sunny San Diego, where we are now. So I needed to have a total career change. So I went back to massage school. And in massage school, I learned about, in like my second semester in hydrotherapy, I learned about something called oncology massage. So I didn't even know you could massage people who are going through cancer treatment. And this really touched me because my mother was diagnosed with breast cancer when I was 8 or 9 years old. So I saw her going through all the therapy, all the surgery, all the radiation. But I had tiny little girl hands and I really felt like I couldn't help her. So to be able to be an adult and understand that not only is it not dangerous for someone to get a massage if they're going through cancer treatment or a cancer survivor, but it's actually beneficial to them was so exciting to me. So I was barely out with my MBLEX and CAMT certification in California, and I was at Moore's Cancer Center in the infusion room doing hand massages on clients. And then I learned in that class about something called manual lymphatic drainage. So this is something that you could do for someone on the quadrant of their body that's at risk for lymphedema, which is a side effect of cancer treatment. So I thought, I was always like, the massage school that I went to, it really had a holistic approach. So I didn't want to give someone 3/4 of a massage. I wanted to be intelligent enough and confident enough to give someone the full body massage. So I went to the MLD class, and then I later took my lymphedema therapist class, which is 135 hours. I flew out to Chicago to take that class, and I came back. And then I was helping people after cancer. I was actually in a nonprofit integrative health clinic as an employee, with acupuncturists, with naturopaths, chiropractors, and doing this kind of bootstrapping like a lot of us do, massage therapists. I had a table in the back of my car, and I was taking private clients. I was taking clients at the office. And then my business combination of plastic surgery clients who had found me over off of social media. And also I was getting referrals for people with a cancer history, especially if you're going through breast reconstruction, and you'll do like liposuction to the area for a fat transfer. And now I also take clients who go and get flap surgery, like deep flap, pap flaps, and then they want the manual lymphatic drainage afterwards. And that practice was so big that luckily I was able to fully transition into just working for myself. So it was a very exciting journey, and I love to still be taking clients. Like this morning, today, after this interview, I have a client after a flap surgery, and then I have a client with lymphedema. But, you know, earlier this week, I had a Brazilian butt lift client, I had a facelift client, I had a tummy tuck client. So I like taking all the clients and using manual lymphatic drainage, using fibrosis massage to help them. So as I'm active on social media, I got a lot of other therapists that were saying, Kathleen, like, what are you doing? How are you doing it? Most importantly, how are you getting the plastic surgeons to refer to you? So in 2019, I started teaching classes. So I'm NCB TMB approved provider. So I give continuing education credits for my online classes. And I now have over 20 classes in my online school and over 4,000 therapists I've been able to help. Yeah.
Wow. What a wonderful story. I freaking love it.
Yep.
So how has it been for you to transition from to now completely working on you for yourself, like personally?
It's easier because I have the plastic surgeons that are referring clients to me. That really is the key. If you can get the plastic surgeons in your area to refer clients to you, if you're also active on social media. So in the beginning, I was taking a mix. I was taking people from who had their surgery in Dominican Republic, in Miami, and still will take clients if they have their surgery in Tijuana, outside of San Diego, and their surgeon or them has seen me on social media, and then they will go ahead and want to book with me. So it really is but at that moment in like 2019, it was really hectic. Like I'd be kind of working in a massage room that I split with another massage therapist. We split the rent, and then I'd be like going around, across town to do the integrative health clinic. And finally, lovely experience with the integrative health clinic, because they kind of wanted me to succeed, and they were sad that I had to go, but they were happy that I developed my practice enough, and they still wanted to say, oh, we want you to be a resource. Like if we have a client that needs to see you, we'll still let them know about you. And I know that that is not the experience for a lot of massage therapists. There's a lot of negatives about trying to break free from that hourly work. But for me, it was a fantastic experience, and something I think it's very beneficial to go with the nonprofit and someone that really wants to see you grow.
I love it. One thing that I love to highlight on the show, it one, I love empowering women, and I love empowered women. And hearing your story of like transitioning from working for somebody to now fully working for yourself and creating a course, and now you're teaching students how to, like, that is amazing. And I'm so excited to have you on and tell us more about everything that you've learned with working with plastic surgery patients.
Yes. So I like to have the attitude that I learn something new every day. And I actually, if you follow me on Instagram, if you follow me on TikTok, you will kind of see the learning process, the part of it that is on social media. So it really starts with listening to the client. And I think it's so important it's important to take the class and have the techniques in your toolbox, but it's equally as important to not prejudge, pre-decide, and decide to have cookie cutter protocols and cookie cutter sessions for every client. Like if you see tummy tuck, you know exactly what you're going to do when you walk in. It's important to have clinician presence, to have the mindfulness in your own personal self-care, so you meet the client where they are and you can really look them in the eye and allow them to share their story with you. Because oftentimes, more times often than not, the issue that is top to them isn't necessarily the issue that you would have addressed first. So that's one of my big things is maybe 4 years ago, I was not giving neck massages to each and every client, but it was talking to Brazilian butt lift client after Brazilian butt lift client and understanding that they're here for reducing the swelling around the liposuction area, but their body needs massage more than just MLD over their surgical area. They are lying prone and their head is turned to the side, or they're awkwardly struggling in, some kind of avocado float, and they're having, right? And it may not be the first week that they have this neck and shoulder pain, but definitely by week 2, week 3, neck and shoulder pain. Same with the tummy tuck, lower back pain. So if we're and a lot of liposuction clients that I see who are answering my messages on Instagram are talking about like this ripping feeling, this tearing feeling, this pain in the surgical area. And we need to, and it's our opportunity as massage therapists that we have the skills that we learned in our first 750 hours in massage school to help that neck pain for them. So the first thing I would say that I learned is to actually speak to the client, have each client come in, and each week the client will have a different experience. You meet the client where they are and then think outside of just that MLD box, that post-op massage box, in order to treat them holistically as a massage therapist, not just I'm going to do MLD on this like 2 foot by 2 foot square foot part of your body, and then like you leave the session, you pay, and we rebook. Like, let's look at the whole client. Let's look at everything they're going through. The other thing I would say is I was fielding the questions and I was really listening to the questions. What is the client's concern about each week that they're going through recovery? Because the client in week 1 is radically different than the client in week 3, which is different from the client in week 5. So now that I've taken so many clients, I can anticipate where you are. And then kind of if we make light of it, and I give you here is your toolbox and you're working on these tools and you're in the middle of this, you are in, the squiggly part of your recovery where it's 1 step forward, 2 steps back, 3 steps sideways. You don't even know where you are in your recovery, but just bring that, up that this is a normal part of recovery. I had plastic surgery. It was a normal part of my recovery. And then we can just gently laugh and bring a little humor to it that like it's called a three-nager. I talk about it all the time. They'll have looked at my Instagram. They know I talk about three-nagers. And then so when they get to week 3, they're like, I really am, so tired of everything. Don't want to do all these, chores. I need to get back to my life. Everyone isn't waiting on me hand and foot anymore, but I'm still in this, compression garment and I still have all these foams and I don't want to wear them anymore. And, and I'm just like, if we can say, yes, this is where we are and this is what reality is. It's not going to be any different than this. And we're just going to breathe through it. That is such a benefit to the client. And then also these very specific questions that I was getting asked over and over again about like, what do I do for my scars? What else can I do for lymphatic drainage? What else can I do for fibrosis in between my sessions? So I looked into the literature, into the plastic and reconstructive surgery journals, the aesthetic surgery journal, and found what the surgeons are researching on that and what the surgeons are telling one another. And I put that in a resource that I could give to my clients at their first visit to say, here is some information that I have gathered on the questions that I anticipate you're going to ask. And then this is something where you can have that peer-to-peer conversation with your surgeon saying, I saw this in the literature and I want to know if this is right for me as your patient. And then you can have that kind of informed conversation. And I'm giving you the resources that you can use to have that informed conversation with your plastic surgeon, who should be the one that is guiding you on these issues. So the combination of that, knowing the questions and then knowing just the past experiences of seeing clients for it's been 8-9 years now has really given me this wealth of experience that you will see that I can make these little videos every day and just go on one little topic and kind of give a hot take on one topic, and then slowly the clients will be more informed, and then if you're a therapist, slowly you will begin to see kind of like the project that we're doing. Like the task that we're doing is the MLD, the fibrosis massage, but the project is to be the person that holds the hand of the client as they go through the surgical recovery and points them to the resources and reminds them that the point of the whole thing is quality of life, and that we're improving their quality of life to get them to their best recovery.
Wow, I love that. And I think I know what you're referring to about the surgeons, what they're telling each other, what they're learning. Is this because some surgeons say you don't need massages and some surgeons say you do, and some surgeons say start them the day of, and some say start 3 weeks later, and some say have 10, and some say have one, and some say you don't need them at all?
Yep, and but it's much more than that. They have a lot of research on like how effective are certain wound dressings, how effective are certain scar dressings. There's so much research out there that they're doing these retrospective studies on this is my technique and this is what I do in post-op recovery. So we are seeing more surgeons saying this is and being vocal about it, because Instagram is a place where you can see more content from surgeon. They're kind of expanding out from just like before and afters, and like funny videos, which they did 5 years ago. And now it's more like they're sharing what their beliefs are about different procedures and the effectiveness of different procedures. So I will say, as far as like some surgeons will tell you, 20 massages you need to start the day after, and some surgeons are more conservative. The liposuction is not just one operation. It's not like buying a can of beans on the shelf and you're pretty sure that the same beans are there no matter what brand it is. It's definitely like a customized surgery, and it depends on so many different factors. What I want to see is a surgeon who is open to the client really focusing on their quality of life and utilizing everything that they can to heal themselves. So it could also be the information about, diet and nutrition, about activity when you're cleared for exercise. If clients will exercise, they will get a better result and they'll get it faster than the client who just doesn't really like exercise. If the client likes nutritious foods, like they're going to get better faster than the client who is only eating French fries. So I think it's something that the plastic surgeons are starting to look more at, because they want that same quality of life. They want that same holistic healing for their patients, and they're open to using everything that they can to get their patients the best results. And they're seeing that their colleagues that are the leaders are using manual lymphatic drainage, just like, some surgeons are using hyperbaric oxygen therapy, and they're really getting the good results. And clients, the patients, may be seeing what the recovery protocol is for one surgeon versus another surgeon, and using that as part of their decision making. Do I want to go with the plastic surgeon that's just like, oh, like just wear a binder, get something off of Amazon, come to see me in like 3 months and 6 months, you'll be fine? Or the surgeon who's really like, I want you to do this protocol, and I want you to maximize your nutrition, maximize your activity, maximize your mindfulness, your stress reduction, and maximize the job of the lymphatic system, help that lymphatic system to reduce the swelling and inflammation faster to get you to your best results.
You hit the nail on the head. And that is why it's so important for people like you, people like me, to educate women who are looking for surgery about all of the different ins and outs and all of the different things that they should be considering when they're going to make that decision, not just price. Or a lot of it is price driven, unfortunately, not just price, but how is this surgeon going to treat me as a whole, from head to toe, from beginning to end. That is what's the most important, in my opinion.
And red flags and green flags for surgeons, and we know this. If the surgeon is going to ghost you, if you never see the surgeon and they don't really have any protocol and they're just like act like, shut you down if you have any questions, that's not the surgeon you want to go to. You want the surgeon, even if I would totally be fine, I'm totally fine with surgeons who are like, how I do surgery, manual lymphatic drainage is not indicated, if they offer the explanation to their patient. Because everything from what I've seen in my practice, if you take the time to describe how you arrived at the decision, why you're doing this, why this is your best judgment, that client is going to follow that instructions because they know why. It's not just a blanket statement, yes or no, or don't worry about it. Like, that is where the nervousness is. And maybe 10 years ago, the client would have just been like, okay, that's not what my surgeon wants. But what I'm seeing, especially in the past 3 months, especially in the past month, with replies to my posts on Instagram and TikTok, is surgeons, your patients are telling me that they're going on Chat GPT and getting their answers. If they're not getting answers from you, they're getting answers from Chat GPT.
Mm-hmm. Mm-hmm.
That's
Yep.
why I love that you are doing these podcasts and you are empowering these surgeons to get their message out to their potential patients, their potential clients. That's what differentiates you in this industry, is that the people who are coming to you because of your expertise, because of how you're explaining everything and making everything understood to them, versus somebody who's just going on price and is perfectly happy to leave their recovery in the hands of Chat GPT.
In the hands of Chat GPT
Yep.
and whatever they find online, and
Yep.
their friend, sister's cousin who says that this is the right thing to do. Yes, I 100% agree. Um, I have some hot takes that I think we should talk about. Let's talk about reopening incisions.
So it's out of my scope of practice. So it is which is fine. It's indicated in there's a reason, and like draining seromas, reopening incisions, pulling drains out. These are in the hands of your plastic surgeon, and someone your board certified plastic surgeon points the finger at and designates that that's the person, that they have done your research for you and they know that this is the correctly trained person to do it for you. But if you're just a massage therapist, if you're just an esthetician, if you have absolutely no credentials whatsoever, you cannot take a weekend course. There is not a weekend course in America, and then in America, that will give you the scope of practice to do the practice of medicine. But that is what several states, including the state of New Jersey, have said over and over again. The reopening incisions and pushing fluid out, it's not lymphatic massage. It's not under the scope of therapy for a massage therapist. And in several states, it's the practice of medicine, which your surgeon needs to be the person, because they have the ethical duty to give your post-op care to someone who is qualified to do it.
So, for our listeners, let me give you a little bit of backstory and a little bit of why this is something that fires us up. It fires me up. So, when you're getting your lymphatic massages after surgery, whatever you want to call them, there's controversy on that as well, what they should be called, if they're lymphatic drainage massages or if they're some other type of massage, whatever it is. Whatever it is. When they're doing this, and sometimes your lipo incisions will heal while they're doing these massages. Maybe by day 3, 4, they're getting pretty close. They're not open anymore. Fluid is not freely coming out of them.
Because your
And what
body is healing.
your body is
That's
healing.
correct. Your body is supposed to heal. You're not supposed to have open incisions.
Exactly. So what some massage therapists will do, or really it can honestly be anybody. I've seen a lot of people do it who shouldn't be doing it. They will reopen those holes while they're before they do the massage so that they can get all the fluid out. They can get all the liquid out so they can get everything out. And the controversy around it is that reopening these incisions introduces bacteria and it can cause infections and it can cause a whole bunch of problems. That's one part of it. The people who are doing it are not supposed to be doing these procedures on you or opening incisions. And the doctors are not real, they can and they will intervene, but I don't think they're really doing anything. Like there's just something that happens. Women get massages and they have their incisions opened and sometimes they get infections and then it comes back to the massage therapist or the doctor or whoever. So that's the little bit of the backstory of why this is such a hot take and a hot topic, because in other countries I've seen videos where they're opening up those incisions and draining and draining and draining. And this is what they teach their massage therapists to do. Go, Kathleen.
Well said. Well said. There's not a question there. I would say my concern would be, for my first concern as a massage therapist is my own business, my own livelihood, my own profession. That it's no one's going to come and suspend my ability to make money to feed my family, because I'm doing something that's outside of my scope of practice. So I would be very cautious for a new massage therapist. If you want to help people after plastic surgery and someone is giving you the hard sell and convincing you, you got to give them a couple $1,000, they're going to increase your scope of practice. You're going to take this weekend certification. You're going to pick up a syringe and start draining seromas, pull drains out, reopen incisions and push fluid out. I want you as a massage therapist, as an esthetician, to go to your board and ask them if it's within your scope of practice. Ask them if you can do it as a responsible business owner and listen to what they have to say and get that in writing. Just make sure that your business is protected because you went to college to have this profession. And I don't want you to lose it because one unscrupulous teacher is going to take your money and risk your license. And then also, I want you to talk to your liability insurance and make it super clear what you're doing and see if your liability insurance covers it. Because if anything goes wrong, like what if someone sues you? What if anything goes wrong with what you're doing? Or is your liability insurance going to cover you? Or are they going to come and take your assets as part of the lawsuit?
Mm-hmm. That's really, really good. A really good piece of advice for our massage therapist listeners. So we talked about the hot takes. We talked about a little bit about you and how all of this got started. I want to spend the rest of this episode talking about swelling, swell hell, whatever our girls are calling it. So let's talk about, because and I know that we tell them, oh, you're going to be swollen, you're going to have some swelling, but they don't really understand it until it's there. And they're like, oh, okay, this is the swelling. This is swell health. So why don't you talk us through that swelling process from post-op day 1 to a year?
Yeah. So post-op day 1, isn't it fantastic? So you'll see a lot of before and afters, and they're all oiled up on the table and they're looking fantastic. And you could look at those pictures and be like, that surgeon delivers results. Like, all I need to do is like shoehorn myself into like a faja, just like sausage it up, pull it as tight as possible, and like hang on with my nails to that tight figure and never let it go. And it's not like that is not what happens in real life. So what we've learned, and I saw this from a great research article that I quote in the Plastic Surgery Recovery Handbook from Dixit and Waugh, that states that they see that the swelling, liposuction swelling, will increase for the first 2 weeks. And then so you'll get at 2 weeks, you'll be more swollen than you were when you come right off the table. And that's natural. That's the process of your body healing. So what we want to do is, as massage therapists, is take that swelling and guide it with our hands into the body's lymphatic system, because your lymphatic system is what takes all the water, the waste products, anything that your cells don't need, back into the fat cells, into the lymphatic system, and then it deposits them right here, which is why we do massage right here, into the venous system. It goes through your heart, then to your blood circulation. Then your kidneys notice that there's more fluid in the bloodstream, and it will activate and take some of that fluid out into the bladder, and then you urinate it out. So after that good, especially I like after liposuction, that first lymphatic massage, you're peeing like a racehorse, you're peeing in the middle of the night. And I'll ask people, how is your urination? And they'll be like, I'm hydrating well, but yeah, like I have peed a lot more since my surgery. And I'll say, this is great. This is your lymphatic system working properly. So we have a good lymphatic system, and we're just going to use this gentle skin stretching movement of manual lymphatic drainage to help the initial lymphatic capillaries open, and then the fluid can come in from the interstitium. So that is what we're doing with the lymphatic drainage. And then also you're doing things in between your sessions. You're doing your mindfulness to like take your nervous system out of fight and flight and get it back into rest and digest, so your lymphatic system can work more effectively. You're doing deep diaphragmatic breathing, because the diaphragm is moving in the body, in the torso, and it's actually going to help you to get more lymphatic through doing this deep diaphragmatic breathing. And then joint movement, walking, your surgeon will tell you, keep on moving, keep on walking. And then following that as far as your surgeon's advice, but not too much too soon. And I know this is one of the great things, like I say, like this holding hands people through their recovery is a project, because I can tell my ladies who really like that Pilates, who really like that hot yoga, like they want to jump in and do too much too soon. And that will cause even more swelling. So we want to follow the surgeon's protocols exactly for recovery, as far as exercise, everything else, but then specifically as far as exercise. And then just understand that according to how much surgery you've had, it could be 6 months, it could be a year before you see the final result. I know with my own rhinoplasty, it's a year for rhinoplasty. For the facelift and the neck lift, it was a good 9 months before I really saw all of the swelling completely go down. So you're going to have good results. At 3 months, you're going to begin to see some of your results. But I say this is when you continue on with the protocol, you continue on with the exercise and with the good nutrition, and you will see your results will improve even more months 6 through 12. So keep up the good work and go into that new lifestyle that the liposuction or whatever surgery was kind of that springboard into your new healthy lifestyle, and like keep it up, and you'll see the results get even better.
Absolutely. I love that, the springboard, because that's actually how it was for me. I have after I've talked about this on the show, how during my um before my surgery, I was completely uh, I say I lost myself in motherhood. I was 100% all about my children. if they were good, it was all about my kids. And I was not paying attention to myself. When had my surgery, I was so excited, and it really kick-started my awakening. My, oh, I'm not just Mavi mom. I'm actually Mavi, and I'm all of these other things too. And that's where it started.
Yep. Quality of life. That's why I really like reiterating quality of life. It's about more than just the before and afters. I want to see a change. I'm guiding you and holding your hand as you go into this change, because people go into plastic surgery to improve their quality of life. I think the after is one visible sign that you have, but it's not the whole thing. It's not the holistic result of plastic surgery. Needs to be high quality of life. We don't want to see someone who has debilitating chronic pain, but they look good in their faja. I want someone who looks good outside of their faja, in that gown, in that sundress, and then also has that confidence and that ability to move their body more freely, and they're smiling more and they're interacting more with the world, and they feel better.
My favorite part, when I was seeing them in the office, they're walking in with their sundress, their hair's done, their makeup's done, they smell good. You can just tell. Yes, girl, get it. I love it. So tell me, I that's part of my favorite thing about what I do is watching women transform. It's my favorite. I enjoy so much watching a woman change from um, not feeling their best to feeling their best. The transformation is insane. And I have so many favorites. Do you have any favorite transformations of clients that you've seen that you've been like, this one woman really stuck with me?
So for me, my favorite transformations kind of link to why I first got into helping people after surgery. And that's my mother being diagnosed with breast cancer when I was very young. And unfortunately, the breast cancer came back when I was a teenager, and she passed away when I was 20. So what I think still personally is that the queen of all transformations is that breast reconstruction client who comes in for that final couple surgeries that are the breast reconstruction. She has been through 1 year of the diagnosis, the treatment, and then being cancer free, and now she's reconstructing the breast, whether with a flap, whether with liposuction. And for me to be a part of that recovery is fantastic. That's why I kind of want to be my own business owner. I have like aromatherapy. My studio looks like a massage studio. It does not look like a hospital bed and a hospital room, and very antiseptic. And I just love to see the women like stepping forward into their new life, reconstructed, and talking about their upcoming vacation, and talking about how they're moving boldly forward to live their life fully, with this experience, informing their ability to take hold of what is truly valuable with their life. And it empowers me too, because when I was young, all I saw is that there is breast cancer. My mom died from it. And I'm really I'm getting very close to the year that she was when she died. So every client that I see that's recovering from breast cancer and is anticipating living 20 or 30 more years, with this wisdom from the journey and then this inspiration to live their life more fully, it inspires me to live my life more fully too.
Wow, Kathleen, you gave me goosebumps.
Goosebumps. Yeah. Yeah. It lets you, yeah, it really brings you to help the people. It really brings you happiness.
Wow,
Yeah.
what an amazing, that makes mine sound so so vain because wow. Thank you for sharing that with us.
You're
I
welcome.
I think it's so empowering and so full circle also, right? Such a
Yes.
full circle moment for you to
Yes.
be
Yep.
able to help women through that transformation.
Yeah.
Well, thank you so much for sharing that with us, Kathleen. That was such a touching full circle moment that you brought me to tears.
Thank you.
Another hot take I have, I want to change subject because I don't want to cry. I don't want to keep crying. Another hot take I have is, what's your opinion on lymph drops?
So this is what I call the lymph tax. So we know about the pink tax from 5, 6, 10 years ago, which is if you have a razor and then you have a pink razor, you can sell that pink razor for twice as much as a regular razor because, quote, it's for women. So what I really see now is there were lymph drops before, but definitely in the past 5 years, when wellness is really taken front and center, lymphatic system, people are talking about it all the time. You're seeing things that are diuretics. You're seeing things that are for helping you poop more, and they're being kind of rebranded as helping the lymphatic system. So I don't think that a diuretic helps the lymphatic system. It can take off some of your swelling, but that is not, it's using the lymphatic system, but it's not making the lymphatic system itself healthier. So if you need a diuretic, that's something you can talk to your surgeon about. But I would definitely take everything that says lymph on the front and turn it over to the back and research the ingredients that you see. And I think it's a huge red flag if they're not telling you what the ingredients are. Because I don't want anyone, if you're going to pay for a diuretic, there's plenty of things in indigenous medicine that are teas that are diuretics, and you can take these teas, or this is something that your grandma will be able to tell you about, instead of paying top dollar for something where you don't know where the ingredients are, especially if everything in the rest of our lives we're trying to get more natural, less highly processed. But then it seems like when we advertise things for the lymphatic system, it's the most highly processed things possible, and we're trying to use it to help ourselves become more naturally well. And that's like a disconnect.
That is totally a disconnect. I get pictures in my DMs all the time of bottles. What do you think about these? What do you, and I
Yeah.
always ask your doctor. If he says yes, do whatever he says. If he says no, don't do it.
Yeah.
Just ask your doctor. You picked him for a reason.
Yes.
If he's saying no, don't, don't you, this is probably something you see a lot. They'll ask one person and one person gives them an answer and it's
Yep.
not the answer they want. So they
They'll
go
keep on
around
asking. Yep.
asking until they get the answer they're looking for, which also happens for surgeons when they're telling them, no, you're not a good candidate for just liposuction, but they only want
Yes.
liposuction. So they go until they find somebody who will just do liposuction on them.
Yes. And social media is not patrolling for lies in their ads. It's gotten especially rampant in the past 6 months, and especially as a lymphedema therapist, I take special umbrage against people who are. It's a gadget. It's some kind of device, and they want to sell it to you, and it's going to magically cure your lymphedema. It's going to magically cure your lipedema. It's going to magically cause you to lose 50 pounds pain free. It's a compression garment or something that you rub on yourself. And just because you see it on social media doesn't mean that that social media has taken the steps to prove that it is true. And just because something says FDA approved, you need to know what it's FDA approved to be used for, because there are a lot of things that will charge you hundreds of dollars. And if it's only FDA approved for like as a heating lamp, it's not going to give you all the promises if it's making promises about wound healing and other types of red light therapy. So that's just as an overarching thing. The best thing to do is talk to someone with a medical degree, talk to your doctor, talk to your surgeon about these, especially if you have a really responsive, good, your A+ green flag plastic surgeon. They will accept texts, they'll accept emails, and they will get back to you. And if you think to yourself, like, oh, it's not enough, it's not a big enough deal to talk to my surgeon about, like, that's my first question, that like it probably isn't a good item. If you can already hear your plastic surgeon saying you don't need this, then you probably don't need it.
That's
Right?
such a good point. Exactly. Exactly. You probably don't need it.
Then you probably, yeah, the lymph drop probably won't work the way you want it to work.
I remember a video that you made recently, maybe a couple months ago, where you were talking about be ready to lose people around you after your surgery.
Yes.
And I think we should really talk about that before I let you go. I really want to hear what you've seen. What have you seen and heard that makes you say that?
Yep. I will say that it's up around 100% of my clients after facelift. And probably a higher percentage after the Brazilian butt lift, a surprisingly high percentage after tummy tuck, and breast lift, which is more of a reconstructive operation. So I'm like, there's a lower percentage of people that get a tummy tuck for vanity than get like a facelift for a Brazilian butt lift for vanity. So, but what you will see, so it makes me mad when people are like, I need to improve my health. And the tummy tuck can improve your health in several different ways. It makes me angry when people will try to fault people for improving their own health. But for a facelift, they will come out of the woodwork. For the Brazilian butt lift, they will come out of the woodwork. And it's because we have people around us who are not our friends. They are happy to go to the club with us. They are happy when the good times are there. They're happy to let you buy them a drink, but they will not be there for you if you have any kind of issues at all. All of a sudden, they are not answering their texts. They're only there for the good times. And if you need friends that are just there for the good times, that's great. But you'll understand, plastic surgery will let you understand really clearly who are your true friends who love you for you, and who's just there to have a good time with you. And you'll see the catty comments. They'll be catty to other people about you. Or the ones who, after you have plastic surgery, will delight in telling strangers as soon as they come up to talk to you, that, so and so, oh, you like she's just throwing, like, that's a boob job, like, oh, that's a Brazilian butt lift, like she had a facelift. And they will introduce your private business to strangers who come up to talk to you. And there are people who, and this is especially, it's important to know that there's some people who are good people, but especially with the facelift, at our age, their reaction to your facelift is them and their own business. It has nothing to do with you and your facelift. It has to do with this big disconnect between they have decided that they won't get a facelift because they're not the type of person to get a facelift. And that's for other people. But then when they see you, who has a common sense and a good head on our shoulders, are taking action for your own wellness, to get the facelift, this is a big giant, like, this is a catastrophic issue in some people's brains where they can't wrap their head around it. And they will just like have to ghost you because they can't be friends with, they never thought that they would be friends with someone who has a facelift, and it's about what's going on with them. And it's not about you or your facelift. So we, as the people who had the plastic surgery, just have to take that deep breath and let the people go if they want to leave. But some people, you will have to make that decision of where they're not going to be your friend anymore because they're not your friend anyways. If you can't go out with them without them telling every man who wants to buy you a drink that, like, you had a boob job, like, that girl is not your friend. I don't care how much fun she is. she does not have your back.
100%. I hear it from my clients all the time where they're like, my sister-in-law started talking about me and started telling other family, or my best friend, or my somebody very close to me. And sometimes it's somebody you would never even expect, that you're like, dang, I thought you would be on the
Have my
board with
back.
it.
Yep.
But what I feel is that a lot of times they wish they could do it. If they had the money, if they had the know, if they had the downtime, if they didn't care about other people's opinions, because that's a lot of what stops women from having surgery or cosmetic surgery. They are afraid of what are people going to say, or who's going to say this, or what are people going to talk bad about me, or whatever. Who cares?
Yep.
If you want to have a tummy tuck, go get your tummy tuck. They probably want it too. If they had the money, I'm sure they'd be on the table. Or face. So many times it's face, tummy, BBL. Girl, once you get your BBL, the haters will come out of the woods to hate on you.
Yep. Yep. And it's just some people are live and let live and some people aren't. I've been a vegetarian for 30 years. My husband's a meat eater. All my friends are meat eaters. I can be at a table where you're eating meat without bringing up the fact that I don't eat meat, without making a big deal about it. I have meat in my fridge right now that I won't eat because it belongs to my husband. But some people won't let your business be your business. They have to be in your business. And those
Mm-hmm.
people are not your real friends.
Not at all. So, okay, I have to let you go from this episode, but I am 100% bringing you back. And if my girls want to come find you, how can they find you?
So I'm on Instagram and TikTok at Kathleen Lisson. And that is the main place to find me, and you'll see my hot takes, a couple hot takes every day, and just like and leave a comment and see. What I really like, what I've been able to do in the past couple years with TikTok and Instagram is this is a place, if you're planning your plastic surgery, that I will, some people will ask me a question and I will throw it out to the group, and then you will see so many people in the comments leaving their experiences. So if you had these tiny little questions about how this recovery from tummy tuck, and am I the only person to have pain after my liposuction, you'll be able to kind of crowdsource that wisdom. And I've had, what's really happy for me in the past couple of years is people are connecting with each other and messaging each other. And then you can find like surgery friends that you'd never know otherwise, but you found them because it's other people that are sharing their wisdom in my comment section, which I love.
I love it. I love that. I feel this generation, social media, TikTok, more providers just being out there, being honest. I think it's only going to help women feel more empowered in their decisions, make better decisions, and ultimately just live happier. So I love that.
Yay. Yeah. Thank
Thank
you
you for
so
being on
much.
the show. And with I'll see you guys next week. Thinking about plastic surgery, but you don't know where to start? I've got you. With 18 years in the industry and experience working with top board certified plastic surgeons, I help women like you make informed and confident decisions. Whether you need help choosing a surgeon, planning your recovery, or understanding what to expect, I've got your back. Skip the guesswork and get expert guidance by booking a call with me today. That's a wrap for this episode of Big Butts No Lies. If you found this episode helpful, do me a favor and subscribe, leave a review, and share it with a friend who's considering plastic surgery. Until next time, stay confident, stay informed, and remember, big butts don't lie.